We're meeting here today. We're going to be speaking with Miss Pegasus and her daughter Emma, 7 years old. She has autism spectrum disorder. When she comes in, we're just going to give her a brief overview of the disease, and everyone will have a chance to speak upon their concerns about their particular field with this patient. Okay, everybody, I'm going to grab Miss Pegasus now. Miss Pegasus, please come in.
Hi. Nice to meet
Pleasure
you.
to meet you. I'm John, the case manager.
Okay, Pegasus.
You
And
can take a seat right
I'm
here.
sorry my child didn't come. She was having a really bad tantrum today, so, okay?
Okay. This is going to be a nurse.
Hi, I'm Nurse Blupazol.
Nice to meet you.
Hi, I'm going to be your occupational therapist. My
Okay.
name is Riley.
Hi, I'm a dietitian. My name's Austin.
Okay,
And our speech language pathologist will be in shortly.
okay. This is overwhelming. Lots of people in here, okay?
I'm Nurse Blupazol, and I'm a member of your interdisciplinary team. So today we're just going to go over autism spectrum disorder. I'm sure that you already know some of these things already, but we're just going to go over it as a team, okay?
Okay, sounds good.
Okay, so real quick everyone, the exact cause of autism spectrum disorder is unknown, but genetic and environmental factors play a part and affect brain development. Usually identical twins will have a higher percentage of ASD, and siblings have a 2 to 8% risk, going up to 12 to 20% if the child with ASD has deficits in 1 or 2 areas. So those areas are impaired social interaction, impaired communication, restricted or repetitive behaviors. And Emma's risk factors are that her mom was 42 when she had Emma. Emma was preterm at 32 weeks gestation. She also had a low birth weight. There's also studies that show a link with exposure to viral or bacterial infections in the 1st or 2nd trimester, and exposure to valproate for the treatment of epilepsy or bipolar disorder. Exposure to insecticides is also another one. These don't apply to Emma. ASD refers to a wide range and variety of symptoms. So people with the diagnosis, it affects their relationships and their interactions with other people. Children will usually develop normally in their 1st year and then regress between 18 to 24 months. And symptoms usually appear before age 3. So ASD is 4 to 5 times higher in boys, and currently it's about 1 in 36 children.
Oh, wow, I never was told that before. This is great to hear. Thank you.
Okay, Miss Pegasus. So I heard you mention that Emma was having some tantrums today, and that's why you didn't bring her in. Can you tell me a little more about those, what they look like?
Yes, she was like hitting her head and was frustrated and overdrawn. She's been like this lately. So this is too many people. I just wanted to make her feel what's gonna be like, so I didn't bring her in.
Great. Yeah, it was great that you're able to recognize that she was feeling sensory overloaded. You know, when we see kids hitting themselves in the head, walking on their tiptoes, doing those hand flaps, those are generally signs that they are needing some more sensory input and they are getting overloaded. So part of my job as the OT will be helping you recognize those symptoms of sensory overload early on so we can intervene a little earlier to prevent it from getting to that tantrum stage. And so I'll work with you and your child to give you the tools to help manage those.
Oh, I would love some, because sometimes I don't know what to do with her. So
I know, it can be very overwhelming.
Okay, I'm looking forward to some advice.
All right, Miss Pegasus. So as I said earlier, I'm Austin. I'm the dietitian. I was just wondering if you have any dietary concerns with Emma.
Oh yeah, she only eats mac and cheese. Everything else is a struggle with her.
That's pretty common with autism spectrum disorder. Kids generally get stuck on certain textures or certain foods, so it's important that we try to introduce new types of foods into her diet to keep her on a nutritionally sound diet. She should be getting about 1,600 calories a day based off of her age. So we have a couple strategies to try to introduce new foods into her diet. The first is picture exchange system. So we have these cards here, as you can see. They have images like eggs, bagels, and she can use this to pick out some new foods, because as I understand, she's not very verbal.
Oh wow.
So she can use this system to identify some food selections that she might eat. As you can see, there's certain ones for breakfast, lunch, and dinner, and all types of things like that. Also, we have the My Plate system, and this is an app that you can use, and it helps to identify the quantities of food that she should be getting per day, like certain servings of fruits and vegetables and grains and such things.
But what if she says no to all that stuff, like no vegetables, no meat? What do I do then?
So since she's primarily eating mac and cheese right now, we can try and sneak some foods into her food like that. We can sneak like peas and carrots into the mac and cheese, or tuna or chicken and stuff like that, to try and incorporate new foods into her diet.
Oh, that's a good idea.
Okay, my name's Melanie, and I'm going to work with Emma on her speech. Is there any concerns that you have regarding her speech?
Yes, I actually have a hard time with Emma communicating to us. She gets withdrawn, she gets off subject, she goes to her room. So I would love some ideas how to deal with her communication better.
Okay, is that with peers as well?
Yes, as well.
Okay, then I will work with her 90 minutes every week to make sure that she is staying on subject, and we will try to make sure that like she will stay on the proper subject at school as well with this work.
Okay.
Yeah, is there any other concerns that you have?
Actually, I do have a question. How do I communicate with her at home better?
A lot of redirection is going to help with this, especially when she's becoming off topic. So when she becomes off topic, just try redirecting her to exactly what you guys are talking about during that communication. Sometimes even reading a book while there is background noise like TV will help them focus more.
Oh, wow, that sounds, I'll try that.
Okay.
Hello, Miss Pegasus. Do you have any questions about any of the professionals that have spoken with you today?
Oh, I have lots of questions. There's so many people in here. I'm just a little confused what's going on.
Yes, well, that's my job. I'm your case manager. If you have any questions about your care in the future, or any questions that happen to come up, I'm here to facilitate you to the right answers, the right person, so we can best help your particular situation.
Oh wow, I've never had this before. This is great. Like, I feel like a queen here with all this help I'm getting. I'm excited.
Well, that's how we want you to feel. And if you need anything from any of us, please feel free to call us.
Okay, hi Mrs. Pegasus, I'm Dr. Williamson. I'm here to talk about some diagnosis and treatment stuff for Emma's ASD.
Sounds good.
So I just want to clarify, ASD, there's no like yes or no blood test on a diagnosis. It's more of a spectrum. The range is from 15 to 60. Less than 30 is a non-ASD child, 30 to 36 and a half is mild, and then over 37 to 60 is going to be a more severe form, which is not a bad thing. The diagnosis process is a comprehensive thing. We're going to talk to you and your husband as Emma's parents. We're going to talk to our teachers, talk to some therapists and specialists. There's going to be observations of Emma at home, at school, during therapy sessions, and a lot of play-based assessments. And it's an overall impression of Emma on a scale. So the kind of treatments we're going to be talking about are going to be like applied behavioral analysis, cognitive behavior therapy. We're going to look at some social role playing to help her interactions with her peers. We're going to talk about some PT and OT, some speech therapy, and even things like art, play, music therapy, or even therapy with things like horses or animals. There is one medication that has been approved by the FDA to help with kids with ASD. It's kind of a last step for me. I like to work with other stuff first, but it's risperidone or Risperdal. It's approved for 5 to 16-year-olds, and it is to help treat their irritability. So that is an option, but I'd like to hold off on that if that's okay with you.
I appreciate that.
That sounds great. Okay, do you have any further questions?
Yeah, so she was talking earlier about infections and bacteria, and I know I read the blog about Jim Carrey's ex-wife. She told that these vaccines are bad, and she probably has now autism because I vaccinated her.
Oh, no. So actually celebrities and social media, they all put out a bunch of myths and wrong information. So it's our job as healthcare providers to let you know the vaccines, they do not cause autism.
In fact, there's been no
Sure,
link. In
my
fact,
God.
that original study has been completely debunked because there is no reliable study, and the original study was retracted due to poor design and questionable research methods. So you did nothing to cause Emma's ASD, and just because she has ASD doesn't mean she can't have a wonderful life that's very fulfilled and meaningful. So we're here to give you all the answers you need.
Oh, thank God.
Okay.
Thank you, ladies.
Okay, team, I think we've had a good meeting so far. Now I'd like to wrap up with some goals that we all have for Miss Pegasus and her daughter Emma. Would you like to start, Riley?
I would love to. So my OT goals for Emma and Ms. Pegasus include that Ms. Pegasus is able to ID those sensory-seeking behaviors, ID signs of sensory overload, apply appropriate interventions, and that Emma will begin to be able to engage in functional play.
Oh wow, that sounds great. I'm looking forward to see how that works.
Yes, and then I'm going to work on having Emma be have better communication between peers and have it be appropriate communication during class, and it's going to be probably 90 minutes a week.
Oh, she needs that. I appreciate that.
And then my goal for Emma is to keep her on a nutritionally balanced diet and introducing new foods into her diet that she finds appetizing. This will be accomplished. We'll use the picture exchange system cards like we discussed, and you can point out new things that you want to try.
Oh, I hope that works. The food is a big challenge, and my husband is already texting me. He's so frustrated. She's throwing tantrums and not behaving, so I just hope also works.
Has this been hard to deal with recently? Has this been a reoccurring circumstance?
Yeah, we have our moments. Sometimes she does better, but sometimes it's worse, so I'm not sure. We tried everything. I'm glad to try something new.
Okay, well, what we could recommend is give you a referral to respite care, and they'll be able to help you more with that. And we can talk about that a little bit later. Did you have any questions about anything we talked about today?
No, not at the moment. It's overwhelming. There's a lot to process.
Well, I did mention respite care during our interdisciplinary meeting. Have you ever heard about respite care?
Yes, you did mention, and actually I was going to ask you about that. No, I don't know what that is.
Well, respite care is a service that we can provide through an order of Dr. Williamson, who you talked to earlier. And she can provide this referral to allow you to have a escape. We can give a caregiver to your house and help you cope with dealing with your daughter having ASD and maybe give you a little bit more sanity.
Oh, wow. Okay.
And I think I have a pamphlet here for you.
Oh, good. I'll definitely look into this. I appreciate that.
And I'll call you back with that referral soon.
Okay, sounds good.
And I'll call you also to set up your appointments and take care of all that.
Okay, thank you very much.
No problem.